Welcome everybody to the Mental Health Network. Again, we're excited to have another mental health video for us. And there's been a lot of talk about the mental health backlash to COVID-19 and the shutdown and economy and just everything that's going on right now. And I've had people ask me what they think we can do as a community to prepare for that and respond to that well. And the best advice that I feel I've given people is to take a mental health first aid course. I took this course last year and it was tremendous. A lot of wonderful practical information, as well as being more comfortable with the topic and being able to recognize when someone's hurting and to respond appropriately. So what I'd like to do is I've invited the two trainers that trained me, and I'd like for them to share with you what mental health first aid is and why everyone in this community needs to get this training. So I'm going to ask them to introduce themselves. So thank you for being here, Jackie.
Yeah, thanks, Rhonda, for having us today. Tell you a little bit about myself. I'm Jackie Haas. I am the president and CEO of the Helen Wheeler Center for Community Mental Health. I'm a licensed clinical social worker and have been practicing in the field for 30 years now. So my range of experience goes from working with children and youth and families through working with adults and folks in their older years as well. So I've been here at the Helen Wheeler Center for about, 26 years, I think it is, and been the CEO for the past 20 years. So we brought mental health first aid to the community through a grant that we wrote for, and we were able to get 5 of us trained in the community. So Ann and I were 2 of those 5, and we're really excited to be able to bring this course to the community. I think it's brought great value. We've trained well over 300 people in the community since becoming trainers in late 2017.
That's fantastic. Ann?
I am Ann King. I am the Kankakee County Field Advocate for the American Foundation for Suicide Prevention. I became involved with them after losing my 13-year-old sister to suicide. As I have been chairing the Out of the Darkness Walk here in Kankakee County, that's how I became connected with Jackie and got trained in mental health first aid. And I feel it's very important to take this course as a mom that supports a teenager with mental health issues. There's many tools that it gives me to help him and others in my community.
Well, let's dive into why people need, what mental health first aid is, and why the whole community should be trained in mental health first aid.
Yeah, for sure. So if we can bring up our PowerPoints.
There we go.
Right, so when Rhonda asked us to come talk today about mental health first aid, we kind of wanted to talk about, why is it important to talk about mental health? Why do we need to talk about mental health, particularly now when we're living in challenging and rather uncertain times? During these uncertain times, many people are struggling with just really trying to figure out what this all really means for us. And sometimes that fear of the unknown and uncertainty can cause us to feel even more anxious and uneasy and just kind of out of sorts. Many people right now are feeling a heightened sense of anxiety or depression due to the health crisis that we're going through. So many were confined to their homes during the stay-at-home order, which really created a lot of stress for some. The loss of employment added to the economic stress and uncertainty for so many, in addition to the fears that were associated to just the general unknown that accompanied this illness. And now we're really also being faced with the compounded unknown of what will happen if a second wave hits, and what will happen when school starts again, and the anger that many feel about everything that I've just said, right? And all of the restrictions that have been imposed on us by others. So I think the goal, that Rhonda had with asking us to be here today to talk a little bit about, how can we prepare ourselves to manage the current situation in order to better manage our mental health and potentially help those with their mental health around us. To give a little bit of background, here's a little bit of data that even before we entered into this pandemic phase, to put a little bit of perspective into what mental health data looked like around the United States. On average, about 6% of adults suffer from a serious mental illness. 1 in 5 teens or young adults live with a mental health condition as well. So the numbers are relatively high, right? About half of all mental health disorders begin by the age of 14. So they do surface at a relatively young age. 3/4 begin by the age of 24. And for almost all mental health disorders, people delay getting treatment. And the median delay is about 10 years. And when we teach mental health first aid, we often ask folks their opinion on why do they think that is? Why do people delay getting treatment for so long? And oftentimes, we get a lot of mixed responses on why that is, but the cause of that is often because of the stigma that's associated with seeking treatment and with having a mental health diagnosis. Folks often don't have insurance to cover that, right? Access might be limited as well. And many people may not know that they're sick. They may not know that they need to seek treatment as well. Anne and I are going to kind of switch back and forth, so you'll get to hear both of us throughout this. So I'll let Anne take the next slide.
We are often faced with the challenge of someone coming to us or having a loved one or family member struggling with a mental illness, depression, anxiety, substance use, or suicidal ideations, and we don't know what to do or who to turn to. We struggle with how to talk about and approach the conversation. We often don't really know what resources are available to refer the person to or connect them with, how we guide them to the most appropriate treatment to get them the help they need. Help offered to a person developing a mental health problem or experiencing a mental health crisis, like CPR, mental health first aid is given until appropriate treatment and support are received or until the crisis resolves. Not a substitute for counseling, medical care, peer support, or other professional treatment. The primary goal of mental health first aid is to teach the participants how to recognize the symptoms of a mental health problem, how to offer initial help, how to guide the individual to professional help that is most appropriate.
So the things that we want to teach folks during the mental health first aid class are really, what you're going to see on this slide here. The class is an 8-hour course, so you are investing a full day in the class, but what you're going to gain out of that is really going to be immeasurable. The course teaches several things. We're going to teach you the risk factors and warning signs of a variety of different mental health and substance use issues. So the risk factors of multiple different mental health disorders, such as anxiety, trauma, psychosis, substance use, depression. You're going to walk out of the room knowing what the common symptoms of those disorders are. You're going to walk out with a 5-step action plan. We talked about, just like CPR and first aid, you're going to have that action plan that you're going to walk out there with, which we'll talk about in a minute. So you'll know how to respond to that crisis. This is an evidence-based course. So it is an evidence-based curriculum that you're going to walk out with. The course is an evidence-based course, so we do stick with the curriculum. It's taught in an adult module, a youth module, and we are also able to teach the public safety module, which is geared for our police force, and we are also able to teach the module for fire EMS. And we've been fortunate enough to be able to teach several police departments in our community, as well as some fire departments as well, and had a great response with that. When you think about those professionals, they encounter so much, trauma and mental health, and the populations that they work with It's just been a great response with them. And when I talked about the original instructors that we had go with Ann and I, we had 2 police officers become instructors with us as well. So they've partnered with us when we do the training, which has been just a fantastic experience as well. If you want to go on to the next slide, you'll actually get to see the 5-step action plan that we teach in the course. So we use acronyms in our world, right? We use that so much. I mentioned just like CPR, you use CAB as the acronym in CPR, compression, airway, breathing. But in mental health first aid, we use ALGE. ALGE stands for what you see on this screen there. So this action plan is what we will use during the course of that 8-hour day to teach you how to respond to the mental health crises that you may encounter. The first being assess for risk of suicide and harm. So regardless of the mental health disorder or crisis that you might encounter, you'll always want to begin by assessing the situation, assessing for safety of the individual. The second step would be listen non-judgmentally. Listening to the person is very important when experiencing distressing emotions and thoughts. They want to be heard by an empathic listener. And we want to make sure that we allow the person to be heard and really understand what they're saying. We also want to make it comfortable for the person so that they can talk freely without being judged. The third step is give reassurance. Once we've established that good listening situation, it's easier to offer encouragement and information. Reassurance can include emotional support, such as empathizing with how the person feels and voicing hope, as well as offering practical help with tasks that might seem overwhelming at the moment. The first E, encourage appropriate professional help. People with mental health problems generally have better recovery outcomes if they get appropriate professional help. However, they might not know all of the available options. Some of these options might include counseling, therapy, medication, and education. So we may need to provide them with that information to help them get linked to those resources. And the final E is encouraging self-help and other support strategies. So encouraging the person to use self-help strategies such as support groups and other self-help techniques such as mindfulness practices, yoga, and also remind them to utilize their natural supports such as family members, friends, and their church or colleagues. And although this acronym is written in a very linear manner here, it doesn't necessarily have to be implemented in this linear type of manner. You're always going to want to assess the situation first. So the A should always come first, but the other steps may not need to always go in that linear fashion. And the cute koala in the corner of the screen there is the mascot of Mental Health First Aid, who's also named ALGE. So a cute reminder of our acronym there.
Great, so here's an overview of all of the topics that are covered in an 8-hour adult mental health first aid class. We go from looking at problems in the United States to the action plan. And then we finish the day with overdose and substance use disorders and how to use your training. The youth course provides a bit more information on topics related to youth-specific issues, such as ADHD, and the new updated curriculum will include such topics as dealing with social media and a bit more on eating disorders. So where mental health first aid can help. Mental health first aid is just one piece along the spectrum of interventions available to prevent mental illnesses or serve as a catalyst for treatment and recovery for mental health problems. This graphic illustrates the progression of a person along the spectrum of being well through recovery along the stages of intervention and treatment along the way. Prevention programs are geared for people who are well or have mild symptoms. These programs might be anti-stigma campaigns, Early intervention programs are focused on people moving from mild symptoms into a disorder. The goal is to keep the problems from worsening. This is where mental health first aid can be a primary intervention. Treatments and supports. These are for people who are unwell with a mental illness or are in recovery. This can be a treatment such as psychiatric, medication, therapy, and counseling. For those in recovery, it might be more focused on peer support.
So this is just a graphic that shows all of the hundreds of thousands of folks across the United States who have been trained in mental health first aid. More than 1 million first aiders have been trained across the United States by more than 12,000 instructors. So this is just a widespread evidence-based curriculum that it runs rampant across the United States. So speaks very well of this curriculum and its popularity. And in Illinois, we're over 35,000 trained in our state alone, it's just fantastic. And this is actually quite a dated slide. So this is from 2017. So these numbers have significantly increased. I think we're actually over 1,500,000 now, the last numbers that I saw. So the folks that we're reaching are just, it's wonderful. This course is available actually to anyone who is 18 years or older, who just wants to learn more about mental health and mental illnesses. The majority of the courses are taught to the general community, to general audiences, which again includes participants from across the community. So you don't have to be a professional. It's actually easier to teach to folks who aren't professionals. And sometimes it's easier, I think, for non-professionals to teach. Anne could probably attest to that sometimes as we teach together. But we're also able to teach the youth mental health first aid class in our community, as we're instructors in that as well. And as I mentioned earlier, we're also certified to teach the public safety and the fire EMS module. But as you look at these numbers, and again, this is not specific to our community, but this course is reaching just a phenomenal number of different sectors across the United States. And I think it's very reflective of the groups that we've trained in our community as well. We've had the pleasure of going into schools, public safety, into churches, and other social service providers as well. So I think it is very reflective of the cross sectors that we've been able to train in our community too. And this is just a fun slide. Lady Gaga and her foundation have been just champions for supporting mental health first aid and supporting it financially as well. And they've really spearheaded the new teen mental health first aid curriculum that has been piloted in several different areas. And we're hoping that will roll out across the United States as well. And I know many of us as instructors are anxious to get trained in that module as well, so that we can bring that to the teen population. As I mentioned in the previous slide, the current curriculum is available only to folks that are 18 years or older. The teen mental health first aid would allow us to train teenagers in this curriculum as well, a curriculum that's designed specifically for youth. So that's really exciting. I think more youth are a little more willing to talk about issues that they're struggling with and mental health issues. So a lot of credit should be given to celebrities that are encouraging folks to talk about that as well.
So what people are saying, here are just a few pieces from social media about what people are saying about mental health first aid. We have the Born This Way Foundation, which is Lady Gaga's. We have Geraldine, Scoop, and Michelle Molina Cruz, all talking about mental health first aid. Mental health first aid works. Aside from the fact that mental health first aid is included on SAMHSA's National Registry of Evidence-Based Programs and Practices, we know that mental health first aid works because we hear from people every day who have used skills they have learned to help a person in need.
So if you're interested in finding where a course may be held, you would go to mentalhealthfirstaid.org, and this is the screen that you would find. You can be directed to the Take a Course tab and find a course, and it will help you find a course that's located nearest to you. So this is the website that you would go to locate a course and find out any other information that you might want to locate, to find out more about mental health first aid. The next slide will give you that website address again. And if you want to schedule a class specifically for your organization, or to get more information about those of us that are locally trained, reach out to us here at the Mental Health Center, Helen Wheeler Mental Health Center, and we're happy to talk with you about getting something scheduled locally. When Rhonda wanted to get a class scheduled for her church and have that done specifically for them there, we were able to get that coordinated and taken care of just by doing that locally here. We didn't have to go through the national website. So that made it a little more accessible and easier to take care of.
We had such tremendous feedback from that day as well. We had folks from the church, staff that participated, and then other community churches came too.
Mm-hmm.
So I would highly recommend other churches to do that as well. And businesses, organizations. You said how many people locally have been trained so far?
We have over 300 trained locally. Yeah. And we've had school districts that have asked specifically to have their staff, coaching staff and whatnot trained. We're working with District 111 right now on getting all of their staff trained through the STOP grant that they've received, which is really exciting.
Yeah.
So Mental Health First Aid is trying to adapt to this virtual world we're living in right now too. Previously, we've had to do all of our trainings face-to-face. That's just the way the curriculum was set up. And we were not able to do trainings virtually by Zoom or GoToMeetings. So since the whole pandemic has started, Mental Health First Aid has tried to adapt their curriculum to allow us to do virtual training. They've also been in the process of updating their curriculum because it hadn't been updated in several years. So they kind of combined the two and are now retraining all of us that are certified trainers to deliver the new curriculum and to be able to deliver it virtually. So during the month of July, they just started allowing us to go through that new training. So we're in the process of becoming trained in the new updated curriculum as well as the virtual delivery of the curriculum. So once we complete that, then we'll be able to do the courses virtually. And there is a way of doing it split delivery. So we can do a portion of it virtually and then a portion face-to-face too. So we're looking forward to those options as we move forward as well.
Can you speak to the maybe the cost so people know up front? It's relatively, and I felt like it was worth every penny. For an 8-hour training, it was such a minimal cost.
Mm-hmm. So the cost for the materials is basically what we charge. It's now $28.50 for the cost of the course. And if we are able to offer CEUs, which is nice. We partner with Kankakee Community College to provide CEUs, and that's an additional $7 if an individual requires CEUs. Us as instructors, we volunteer our time. So that definitely keeps the cost of the training down. So it is very reasonable for 8 hours. And even if you're needing the CEUs, you're getting that for less than $40. So that's certainly a reasonable day of 8 CEUs. Yes.
Thank you so much for being here. And
thank you for having us.
Yeah, definitely appreciate it.
I hope we get some responses from the community. People book some trainings and go to Helen Wheeler Center's information. I'll make sure that that's on the site, and Book some trainings, folks. This is really good stuff. Even in an 8-hour training, I walked away with so much information that I still could go home and go through and learn. You walk away with so many resources. And so yeah, thanks for all you're doing. You're a tremendous gift to this community. And
Thank you.
Thank you. You too. We appreciate all you do as well.